Assalamualaikum warahmatullahi wabarakatuh. Hello guys, my name is Maryani. Here I will read an article related COVID-19. A nurse contribution in anti-COVID-19. Nurse contribution in anti-COVID-19 because of the mild or even undetectable nature of symptoms of COVID-19 in some infected patients. This new respiratory disease has been able to spread rapidly on a global scale. Nurses are the frontline healthcare professionals who work across acute care hospitals, long-term care agencies, nursing homes, school, community, and government healthcare agencies. The multiple roles and functions played by nurses are particularly important during this COVID-19. The first is providing health education, screening service, and support for the general public and for individuals in high-risk categories. Health education should cover strategies for infection prevention, for example, washing hands regularly, avoiding touching the eyes, nose, and mouth, canceling group activities and communal dining, and early detection of infections. Signs: respiratory symptoms, cold, fever, and muscle soreness. Screening service focuses on screening individuals for potential infection, whereas support focuses on providing emotional support to those isolated because of COVID-19. The second is nosocomial infection prevention and surveillance. Nurses screen suspected cases, recording case histories of contact travel, implement standard precaution. Hand hygiene, respiratory hygiene, personal protective equipment, injection safety, medication storage and handling, and disinfection, and education and training patients, families, and healthcare staff to prevent nosocomial infection. Furthermore, nurses implement isolation care and monitor using the mobile location finder system, provide supplies to conduct fever and respiratory symptom assessments and provide emotional support to individuals under mandatory home quarantine restrictions. The third is the protection of patients with immune deficit or underlying diseases such as chronic obstructive pulmonary disease, chronic illnesses, and cancer. These patients face significantly higher health risks from a COVID-19 infection than the general population. Patients with cancer, especially those with hematological malignancies, who are currently receiving chemotherapy, as well as patients receiving immunosuppressive therapies or bone marrow transplants, must be particularly well educated and cared for to prevent infection. Educating patients on self-protection strategies is a critical function of nurses. The fourth is providing care to patients with COVID-19 who are in acute or critical condition. COVID-19 may induce several pneumonia and even lead to mortality in every age group, with the highest risk group including older adults and individuals with immune deficit. Thus, it is important to provide urgent, intensive care to patients who are infected and symptomatic, particularly so for those with severe conditions. Ensuring that healthcare providers are fully protected by adequate personal protection equipment is necessary to prevent them from becoming infected. Intensive care capacities in terms of both manpower and equipment are very important. In intensive care, nursing staff provide direct life sustaining care to help patients recover from COVID-19, induce pneumonia, as well as provide psychological support to patients in states of panic or distress.